Gestational diabetes isn't just a pregnancy issue, it's a health concern that can have lasting effects. This temporary condition affects blood sugar levels, often silently, but its impact can extend far beyond childbirth. Understanding gestational diabetes is crucial for everyone, not just expectant mothers. From its sneaky onset to long-term health implications, this condition deserves attention. We'll explore its causes, diagnosis, and management, equipping you with knowledge to tackle this metabolic challenge head-on. What is gestational diabetes? Diabetes during pregnancy is a condition that shows up when a woman is expecting. It happens when the body can't handle sugar properly during this time. About 2 to 10 out of every 100 pregnant women in the United States deal with this each year. Unlike other types of diabetes, it usually goes away after the baby is born. But it's still important because even slightly high blood sugar can affect how the baby grows. It happens because the body can't make enough insulin to keep up with the changes of pregnancy. New research shows it might also change how the placenta works and how the mother's body handles fat. Understanding this helps doctors know how to check for it and treat it, which is crucial for keeping both mom and baby healthy. Gestational diabetes causes. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. We're still learning about what causes diabetes during pregnancy, but recent studies give us some clues. Hormonal changes seem to play a big role, making it harder for the body to use insulin effectively. The placenta, which connects mom and baby, might also send out tiny particles that affect how the body handles sugar. Genetics matter too. Some people are more likely to get it based on their genes. To lower the risk, doctors suggest testing early for those more likely to develop it. Staying active and eating well can help your body use insulin better. Scientists are even looking at how the bacteria in your gut might be involved, which could lead to new ways to prevent it. Keeping your gut healthy with a varied diet might be more important than we thought during pregnancy. Gestational diabetes risk factors. Knowing what puts you at risk for diabetes during pregnancy is really important. Research shows that being over 35, overweight, or having diabetes in your family makes you more likely to develop it. Some ethnic groups, like African Americans, Hispanics, and Asians, are at higher risk too. If you've had it in a previous pregnancy, you're more likely to get it again. But don't worry. There are things you can do to lower your risk. Staying active, keeping a healthy weight, and eating well, think whole grains and lean proteins, can really help. If you have several risk factors, your doctor might want to test you earlier in your pregnancy and keep a closer eye on you. By working together with your healthcare team and taking care of yourself, you can have a healthier pregnancy and baby. Gestational diabetes symptoms and signs. Spotting diabetes during pregnancy can be tricky because it often doesn't have clear symptoms. Some women might feel more thirsty, need to pee more often, or feel extra tired, but these can seem like normal pregnancy changes. Research shows that even slightly high blood sugar can cause problems, so it's important to pay attention. Some women might gain weight quickly or get infections more easily. Rarely, changes in vision or nerve pain can happen. Because it's hard to tell on your own, regular checkups with your doctor are really important. They usually test for pregnancy diabetes between 24 to 28 weeks with a special blood sugar test. Remember, catching it early means you can start managing it sooner, which is better for both you and your baby. Gestational diabetes diagnosis. Catching diabetes during pregnancy early is really important for the health of both mom and baby. Doctors usually test for it between 24 to 28 weeks of pregnancy using a special sugar drink test. Some experts suggest this one-step test for everyone, while others prefer a two-step process, starting with a simpler test and following up if needed. New research shows that testing high-risk women even earlier in pregnancy might be helpful. Scientists are also looking into new ways to test for diabetes that might be easier or more accurate. No matter which test is used, it's crucial that all pregnant women get screened. Finding out early if you have diabetes during pregnancy means you can start managing it sooner, which greatly reduces the chances of complications. Impact on pregnancy and baby. Diabetes during pregnancy can affect both mom and baby in important ways. Research shows it can lead to babies being larger than average at birth, which might cause difficulties during delivery or increase the chance of needing a C-section. Newborns might also have low blood sugar or yellowing of the skin, jaundice, right after birth. In the long run, these babies have a higher chance of becoming overweight or developing diabetes themselves later in life. For moms, having diabetes during pregnancy makes them much more likely to develop type 2 diabetes later on. The good news is that proper care can greatly reduce these risks. This includes eating well, exercising regularly, and sometimes taking medication. Early diagnosis and thorough care are key to keeping both mom and baby healthy. Management and treatment. Managing diabetes during pregnancy is really important for the health of both mom and baby. Research shows that proper treatment can significantly reduce serious complications. The main goal is to keep blood sugar levels under control, primarily through lifestyle changes. Eating the right foods, especially those that don't cause big spikes in blood sugar, can help most women manage their condition. Regular exercise is also key, as it helps the body use insulin more effectively. If diet and exercise aren't enough, medication might be needed. Both insulin injections and certain pills can be effective. New technology that constantly monitors blood sugar levels is showing promise in helping women stay on track. Remember, with the right care, most women with gestational diabetes have healthy pregnancies and babies. Medications and insulin therapy. Sometimes diet and exercise aren't enough to manage diabetes during pregnancy. In these cases, medication might be needed. Research shows that insulin can help reduce risks for both mom and baby. There's also good news about other options. A pill called metformin can work as well as insulin for controlling blood sugar, and it might help moms gain less weight. New technology that constantly checks blood sugar levels can help doctors adjust insulin doses more accurately, leading to healthier babies. There are different types of insulin available, and some work faster than others. Your doctor will help choose the best option for you, considering what you prefer and what works best for your lifestyle. The main goal is always to keep both you and your baby healthy throughout the pregnancy. Lifestyle changes. Making smart lifestyle changes is key to managing diabetes during pregnancy. Research shows that eating the right foods, especially those that don't cause big spikes in blood sugar, can really help control your blood sugar levels. Combining a healthy diet with regular exercise can lower the risk of having a very large baby. Doctors recommend staying active, as even moderate exercise for 30 minutes a day can help keep your blood sugar in check, both before and after meals. Don't forget about managing stress. Techniques like mindfulness can also improve your blood sugar control. The great news is that by consistently making these healthy choices, many women can avoid needing medication to manage their gestational diabetes. Small changes in your daily routine can make a big difference for both you and your baby's health. Postpartum care and long-term health. After having gestational diabetes during pregnancy, it's crucial to stay vigilant about your health even after giving birth. Research shows that women who've had this condition are much more likely to develop type 2 diabetes later on. Doctors recommend getting your blood sugar checked about 1 to 3 months after delivery. This simple test can catch any lingering issues early. The good news is that making healthy lifestyle changes can really help. Eating well and exercising regularly can cut your risk of getting type 2 diabetes by half. It's important to keep up with regular checkups in the years following your pregnancy too. Studies have found that yearly screenings and targeted health interventions can significantly delay or even prevent diabetes in women who've had gestational diabetes. Taking care of yourself now can make a big difference for your future health. Gestational diabetes is a manageable condition with far-reaching implications. Armed with knowledge about risk factors, diagnosis, and treatment options, you can navigate this challenge effectively. Remember, proactive care and lifestyle changes not only safeguard your pregnancy but also pave the way for long-term health. Stay informed, stay vigilant, and prioritize your well-being. You might also want to watch this video for other needs, and please subscribe to this channel if you found this video helpful. Thank you for watching.